we'll first get the whole area anesthetized, and then once we have it anesthetized, then we will start with getting the fat out. I think we will be requiring to take the fat out both from the central part of the stomach and the sides, so that we have enough amount. Okay, I'm starting near your umbilicus. You just feel a small prick. When I'm starting with the anesthesia process, first you'll feel something moving under your skin, and then there'll be a stretching feeling, and then it'll all be numb. Okay. Okay, so this is what you're going to feel. I am just placing the anesthesia fluid under your skin. Okay, this will be the part which is slightly uncomfortable. Once you have the anesthesia in, you won't feel anything after 10 minutes. Okay, so you just have to help me in the next 10 minutes where I'm anesthetizing it. This is all that there will be during the whole procedure. Okay.
So you're inserting the anesthesia inside the
Yes,
skin?
I am inserting it below the skin, above your stomach and below your skin. Above your stomach and below your skin is where all the fat is. When you're pushing it, then the fat comes in much more easily. So you have the openings here. So what we are doing today is a stromal vascular fraction procedure for hair loss. Of all the sources of stem cells in our body, the adipose derived stem cells are one of the easiest to harvest and one of the most abundant ones. The other common source from where stem cells are usually harvested is the bone marrow, but that is much more uncomfortable to get, much more painful. The fat is an easy source to harvest. When we harvest the fat, when we are doing the stromal vascular fraction procedure for hair loss patients, we don't need the volume of fat. What we require basically is the regenerative effects of it. So fat as a procedure can give us two functions or two objectives. One is when you want to restore volume. So for areas such as the under eyes, or when you have aging, when patients go above 35 years of age or 40 years of age, and there's volume loss in the face or other areas of the body, we can use the fat to replace that volume, to lift the face, to fill in those volumes and look younger. The second indication is when we want regenerative effects, and that can also happen in aging. So when we use fat for aging indications, we use both the volumizing effect and the regenerative effect. Specifically, when we want the regenerative effects of fat, like we are doing in this patient, we are getting the fat out, harvesting it, converting it into nanofat, and then that nanofat is then filtered again to discard all the emulsified oil that is there in the nanofat, and what we get below is a stromal vascular fraction and extracellular matrix combination. It's a gel, so there's a paper published about it, the stromal vascular fraction and extracellular matrix gel. This gel we dilute it with platelet rich plasma and then inject it in the scalp of our patients. Usually done once a year, especially for patients who are not able to do repeated monthly PRPs. This is a good procedure. We've been doing for almost 5 years now. Most of the patients in whom we do it are happy. Of course, like all other hair loss treatments, it has to be a combination approach. The patients are also on medicines like finasteride, minoxidil, and nutritional supplements. Also, what to expect in terms of results is any hair loss procedure that we do, it usually takes 3 to 4 months for the hair loss to stabilize and new growth to start. Whatever hair follicles are in a resting phase for them to get reactivated, for the cycle to reset, and then the hair follicles to start growing again. It takes 3 to 4 months for all of this to happen, and for the results usually 6 to 8 months is what we see, and this is true for any hair loss procedure. When we're doing this specific procedure, the care that you need to take is post the procedure, the area from where we harvest the fat, that may be tender for about a week, like when you do a lot of abs after a big gap and your abdomen is tender. That is how the area from which we have taken the fat may feel for a week. Once that is, that's the only thing actually. If the procedure is done in a proper way, in a sterile way, then it's very safe. There's no worry that we usually have in terms of complications post the procedure. The only uncomfort that you have during the whole procedure is at the initial beginning of the procedure, when we give anesthesia entry point, and then we anesthetize that whole area with Tumescent anesthesia. After 10 minutes, the area becomes numb. Once the area becomes numb, then we start with the procedure, get the fat out, harvest it in a very sterile and delicate way so that the fat cells are not damaged. Once we have the fat out, process it into nanofat, then centrifuge it to get the stromal vascular fraction and extracellular matrix gel, and then mix it with PRP and inject. That's the whole procedure, and we are very thankful for our patient today who has allowed us to record this and share it with all of you, and we'll see you again. The only care that you have to take post this is maybe 1 or 2 days no bath. After from day after tomorrow you can take a bath. There's not going to be any stitches. It's a very small entry point, 2 millimeters in diameter. You're going to cover that with band-aids and then do a larger compression dressing. The more number of days that you're going to keep the compression dressing, that's going to be better, because that compression helps faster healing and also reduces the discomfort to an extent.
And I'm going to like physiotherapy, like chiropractors and all those things. So
what area?
Like whole body, like my muscle joints are like misaligned. So they are working on that.
I think light exercises are completely fine 2 or 3 days later, not a problem.
So they asked me like which part to avoid. So
you can avoid the abdomen for a few days. To be very frank, no problem as such. But 2, 3 days, 4 days, if you're able to avoid, if it's just tender, maybe then avoid. If you're comfortable, you can do it, not a problem. We have not touched your muscles. Okay. We were just in the fat layer, so it's very superficial. You can do everything else that you want to.
Okay, they're just like pinpointing some like small needles and putting into my muscles.
Nothing in the abdominal area for a week. So no acupressure or no acupressure for at least 10 days.
For at least 10 days?
Yeah, in the abdomen area. Everywhere else on your body, you're free to do whatever.
Okay. Can you mark it down some?
Of course, I'll show it. Once we're done, I'll show it to you. Okay. So once you have harvested the fat, this is how it looks. This is the yellow fat, and this is the Tumescent fluid. So the anesthesia, that fluid that we used to anesthetize the area, this is that. We are washing the fluid, discarding this Tumescent fluid, and the fat that we have, we'll centrifuge it, convert it into nanofat, centrifuge it again, and then the gel that we get, which I'll show you, is what we'll mix with PRP and inject. Post the first centrifugation, this is how it looks. This is the fluid, that's Tumescent fluid, and this is the fat. Now we'll convert this fat into nanofat. Then we won't be able to get this is the output that we want post. So once we have centrifuged the nanofat, this is how the separation happens. This is the emulsified nanofat which we are going to discard. This has no value in terms of hair loss procedures. This thing that we see in between, this is what is important for us. This contains the extracellular matrix and the stromal vascular fraction that is there. So this part is what we are going to mix with PRP and use it for the procedure.